Welcome to Integrated Medicine Perspective. I'm Dr. Winnie Liu. The pandemic has permitted many people to take zinc supplement to ensure an adequate intake. However, people's experiences with zinc supplementation vary greatly. Some people believe zinc is effective in preventing and treating COVID infections, while others have not noticed significant benefit. Some have even had symptoms of zinc toxicities. So, why do people take zinc for preventing and treating COVID infections? Does it actually work? Is zinc supplementation more beneficial or more harmful? Let's first talk about why zinc may impact our body's response to infections. Zinc plays a critical role in the normal functioning of our immune system. Zinc deficiency is quite common in low income countries where children are susceptible to various infections, including pneumonia, leading to high severity and mortality rate. So it is easy to see why zinc is thought to be a helpful adjunct to the treatment of infections. So, is zinc supplementation effective? Well, previous clinical trials provided mixed results, pretty much like people's experiences with zinc supplementation in preventing and treating COVID infections. There has not been a consensus on the use of zinc for preventing or treating infections, whether it's pneumonia, infectious diarrhea, or the common cold. So, why do we get mixed, inconsistent results from clinical trials? I will share my thoughts a little bit later, but let's continue with zinc's benefit on the human body. In addition to its vital role in the immune system, zinc is also very important for the growth and development, wound healing, hormone secretion, neurological structure and function, and etc. So, zinc deficiency has a wide array of manifestations, including increased susceptibility to infection, stunted growth, hypogonadism, meaning low ovarian or testicular function, slow wound healing, skin issues, metabolic disorders, and neurological abnormalities. I will give a couple of examples. Zinc regulates the structure, secretion, and function of insulin. So, a deficiency can lead to insulin resistance and abnormal sugar metabolism. Zinc deficiency can also affect our vision, smell, and taste. So, who are at risk for zinc deficiencies? Firstly, people with insufficient zinc intake, such as vegan and older people, are susceptible to zinc deficiency. Secondly, people with absorption disorders, such as those with chronic intestinal inflammation like Crohn's disease, and those who have had weight loss surgeries. Research indicates at least one-third weight loss surgery patients suffer from zinc deficiency. Finally, people with chronic diarrhea are susceptible to zinc deficiency due to excessive zinc loss through stool. Now, completely on the opposite end, zinc supplementation comes with certain risks. Excessive amount of zinc supplementation can cause acute toxicity, resulting in symptoms of nausea, vomiting, headache, and dizziness. Long-term zinc supplementation can affect copper absorption, leading to low copper levels, which cause decreased immune functions. Long-term zinc supplementation can also lower HDL, high-density lipoprotein levels, known as the good cholesterol levels, and interfere with magnesium absorption, leading to magnesium deficiency. Globally, approximately 17% of the population suffers from zinc deficiency, but the prevalence is not distributed evenly among countries. In the developed countries like the United States, the occurrence of zinc deficiency is relatively low, but in the underdeveloped countries like in Southern Africa and Southeast Asia, the prevalence of zinc deficiency can be as high as 70%. Now let's discuss why the results of those clinical trials on the effectiveness of zinc supplementation for preventing or treating infections are inconsistent. Well, there may be many contributing factors, such as zinc dose and treatment duration. Here are some factors I think important to discuss. First, in cases with zinc deficiency, zinc supplementation can correct this nutritional abnormality and have a positive effect. But in cases with an adequate zinc status, further supplementation may not provide additional benefit in terms preventing and treating infections. So the zinc status of the study population or their dietary zinc intake are important factors to consider in the clinical trial designs. Second, zinc deficiency often coincides with the deficiencies in other nutrients, such as iron. So, supplementing a single nutrient, in this case zinc, may not address the overall nutritional deficiencies. Nutrient interactions are complex, and maintaining an optimal immune function requires synergistic actions of multiple nutrients. So, in the case of treating zinc deficiency, a comprehensive strategy to address the overall nutritional imbalances is likely more effective than replacing zinc alone. Finally, long-term zinc supplementation can affect absorptions of other nutrients, such as copper, and low copper levels decrease immune functions. So, zinc supplementation does not necessarily guarantee an improved immune function. It can actually cause decreased immune function through its interference with other nutrients. So now if we ask whether zinc supplementation is more beneficial or harmful, it is easy to see zinc supplementation is beneficial for zinc deficiency, but with an adequate zinc status, zinc supplementation not only may be unhelpful, but it can also be harmful. Finally, I wanted to share some perspectives in zinc intake. The recommended daily zinc intake is 11 milligrams for men, 8 milligrams for women, and 11 milligrams for pregnant women. Zinc-rich foods include seafoods, meats, tofu, and certain nuts and seeds. So if these foods are lacking in one's diet, replacing deficient nutrients accordingly is very much necessary. But we needed to make sure the replacement does not exceed the recommended daily intake. However, I would always strongly recommend striving for dietary balance whenever possible, because it is difficult to obtain an excessive amount of zinc through foods only. When zinc is only obtained through foods, it is difficult to reach 50 milligram on a daily basis, while the upper tolerated limit of zinc intake is 40 milligrams for people 19 and older. But with the method of medication intervention, it is much easier to overdose. With the known interactions between zinc and other nutrients, it is advisable a clear indication for zinc supplementation is needed before starting it, and the exact dose, treatment duration, monitoring, and relevant dietary modifications should be under the supervision of a specialist. That's all for today's discussion. Please leave comments and questions. I will see you soon.